I'm Heather Story. This is my video for the AVMA requirements for the class Vet Nursing Care. This is the fall semester of 2019, and the class number is VTHT 243931420. Enjoy! I'm going to explain and demonstrate how you would listen to the heart and lungs of a patient. This is important to know what you are listening for so you can determine normal from abnormal. So starting with the lungs, when you listen to them, you're going to divide them into 9 quadrants on both the left and the right side. Normal respiratory sounds are going to be loud and harsh. The sounds that you want to listen for that would be determined abnormal would be wheezes or cackles. Those could be signs of fluid or pulmonary edemas, and those you want to alert your doctor to. You also want to listen to the trachea just to make sure that that airway is clear as well. This time when I listen, I'm going to count how many respiratory rates I find in a 15-second span, and I'll give you a respiratory rate. So in that 15-second time, I counted 7 breaths, so multiplying that by 4. She has roughly 28 breaths per minute. Her lungs sounded loud and clear, which is a good sign. For listening to the heart, a typical heart sound you're going to hear is lub-dub. You're going to have about a second split between each heart rate there, and you're going to want to listen to both sides. Some abnormal sounds that you might find are if there's a swish in between that lub-dub, that could be signs of a heart murmur, and that is something that you definitely want to alert the doctor to. There again, for counting a heart rate, you can listen for 15 seconds and multiply by 4. So now I'll begin on the left side, and I'll also begin and listen on the right side as well. Alright, so upon listening to her heart, there was a clear lub-dub sound. Her heart rate was about 100, so I counted 25 beats in a 15-second span there. Definitely a little bit nervous, but that's okay. She's in a new environment, so that's always something that we take into consideration too. I didn't hear any swishing sounds. You also can feel, when you're listening to the heart, feel the femoral pulse. You can compare the characteristics between the femoral pulse that you're feeling and the rate, how the heartbeat sounds, because that can also kind of determine on, is this a true heartbeat that you're hearing, is it sound, and give you a more good idea of what their heart is, of how their heart is beating. So we're going to perform EKG on Lila here. You see my helper already has her laying in right lateral recumbency. That way that is the proper position to perform an EKG to get proper readings. When we place our leads, I have them laid out here. So either all color-coded for which leg it goes on. I always remember that white goes on white goes on right, and snow over grass, and that will be on the right arm and the right leg. And we also have smoke over fire, and those go on the left leg and left arm. And our brown one here is for the ventral or for the chest area. So the thing when positioning is that none of them the legs are not touching. Put the ventral one here on our chest. So make sure I put the white lead on our right arm, just below the elbow here. The green go on the right leg, just at the stifle. There we go. Smoke over fire, so the red goes back on the left leg. The black will go on the left arm. It's a good idea to help minimize artifacts. We just use a little bit of alcohol to put on each location. That just helps with the contact and minimize the artifacts. And now that we are in position, get our machine going here. Oops. There we go. Alright, so now our lead is tracing. We'll let it run for a good solid bit here, that way we have plenty of seconds to compare. We are getting a little bit of artifacts there, so I'm actually going to pause it and see if I can make adjustments to help prevent artifacts. There you go, those are coming out a little bit more even on our strip here. That way we can get a more accurate reading and interpretation of our EKG. So things that we'll be looking for, once I get it long enough here, we'll stop it and then we'll be able to analyze it. Okay. There we go. So now that we have our strip here, kind of come over here so we can rest a little bit. Main things that you want to look for is patterns. Are there any irregularities? And if they are they regular irregularities or are they irregular irregularities? Here they're all looking pretty regular. There is some gaps between each of the QRS complexes and the P waves and the T waves, like through here, that could indicate something such as a sinus arrhythmia where the heartbeat rests for a second in conjunction with the respiratory rate. You can see that there is a P wave for every QRS complex and vice versa. You can notice that the T waves there are all looking even. There was one that I saw that made me kind of question, especially with this patient who has a history of VPCs. Where did it go? There it is. Passed by it. So on this one here, you can see, whoops, let me see if I can get this a little bit better here. So we have here we have our P, we have a QRS complex with a T, but then here at this next one, it is reversed, as well as there is no P wave associated with this QRS. So that could be signs of a potential VPC that Lila has, which she does have a history of. Other than that one though, everything looks even. There's P waves with every QRS. Everything looks pretty regular. Like I said, there is a few little, the little bits of irregularity or regular that could indicate, like I said, the sinus arrhythmia. So all in all, except for that one VPC, looks like she had a pretty good EKG. And that would be how you would take one, as well as be able to interpret it, as being able to read those EKG lines is critical, especially for when you're in anesthesia, so you can see if there's anything you need to alert your doctor to. So I'm going to demonstrate how you would use a rabies poll and some of the reasons why you'd want to use a rabies poll. Obviously, rabies poll, reason why is in the name. If you have a rabies suspect, you're going to want to use a rabies poll. This will help keep that suspected rabies patient or super aggressive dog away from you at arm length, so to speak, so they can't come and get you like they would with a normal leash. Lila here is super friendly. She's the super friendliest dog on earth. But to demonstrate, you can see I'm staying the length of the pole away from her. I'm going to slide the end of the rabies pole restraint over her neck, and I'll pull back. And so now I have it where she can't back out of it. She can't come towards me, and I can keep her closer to the corner as needed so we can do whatever is needed to be done. To release, I just pull on the end here. I'll try to pull it slow, and I release them, and then they are free to move about, preferably in their quarantine quarters. Properly cleaning and disinfecting a cage, a kennel, a run, anything that a patient is put in is very important, as you want to make sure that any diseases or any pathogens that a patient has is not transferred to the next patient that is in that run. So here we use Rescue as our all-around cleaner. This has a contact time of 1 minute. So when cleaning it, I'll come into our cage and I'll spray down all sides, the top and the bottom. Give a good spray all around. I'll also spray down the door. That way, since a lot of times you'll see the patient with their nose up against the cage door, I'll also spray the outside of the door. Since Rescue has a contact time of 1 minute, I will set our timer and we'll be back in a minute. So our timer for the contact time for rescue for a minute has just gone off, so now I'm going to wipe it out. So first off, I do another quick spritz just to kind of help loosen up any debris. And it's taking some towels or washcloth, wipe in the proper order. I'll start with the top. Make sure I get all the corners. Then I'll do the 3 sides. I do the back. And then once the sides are done, I will then do the bottom of the cage. I'll then also go and wipe down the door as well. So we do it in this order because the top and the sides, they do not have as much contact with the patient as the bottom of the cage does. Typically they're going to be sitting on the bottom, so if they had any, if they expelled any bodily fluids, diarrhea, vomit, anything like that, it's going to be listed on the bottom. That's going to be where most of the pathogens are at, so you want to save that for last. That way you don't transfer anything from the bottom of the cage to the cells. So we're going to do the smear tear test on Dozer here. The way this test works is we have 2 little paper strips that we place in the eye, kind of tucked under the eyelid for about a minute each. What this test does is it measures basal tear production and reflex tear production as well. There we go, bud. So I'll hold it there for 60 seconds. I know, bud. I know. Good boy. This is a good test to check for if you're worried and suspect dry eye. This is a good way to test it. Already he's passed the normal amount, which greater than 15 is considered normal. He already passed that, but it's still always good to hold it for the full 60 seconds so you can get an accurate result. We're almost there, bud. Almost there. I know. Hang on, bud. Being a very good boy. Good boy. Good baby. There we go. So his right eye came in at 26. There you can see how it kind of turned blue as it went down. That is how it measures the tear production. So now we'll move on to his left eye. And so his left eye came to about 22 there on our little strip there. So these are good to know, indicate how their tear production is, and if there's any potential for dry eye. Like I said, greater than 15 is considered normal, so he's definitely in the normal range there. So now on Dozer here, we're going to take tonometer readings using our tono pin. First off, I'm going to put some tetracaine in each of his eyes and let it sit for a minute or so while I'm calibrating the tono pin. This just helps numb the eye. That way, as I'm putting pressure on the eye with the tono pin, it doesn't cause discomfort. I'm going to calibrate my tono pin first off. So I'm going to hold it. Press and hold the activation button for 5 seconds, at which point it should have it upside down up. So I'm going to watch that, and it should say that about 15 seconds it should have that up with a beep. So now it does. I'll hold it straight up, and so that time it passed. So now this is ready to go. On it, you always want to make sure you change that out for each patient. So I'm going to take an average of 3 readings on each eye. So you want to take an average of 3 readings. So it was like 9, 10, and 13. So that would be an average of of about 11 or 12 or so, which is on the lower end of the normal range, but is still normal. So now we'll move on to his left eye, and I'll do the same process. A 20, a 13, and a 13. So we're gonna check for any potential ulcers using stain pickup on a fluorescein stain test here. So this result, it will help determine if there are any ulcers. The first step is I'm going to moisten this strip here with just some ophthalmic solution here. I'm going to put a drop in each of his eyes. There you go, bud. Once those drops have been and kind of sat for a few seconds, I'm then just going to rinse the eye out. So rinse that stain out of his eyes. I'm sorry. Can you go other eye? I'm sorry, but you got to bring it over you now. So now once I've applied the stain to his eyes, I'm going to check and I'm going to look with just visual inspection to see if there's any stain pickup. That stain pickup will look like a bright green blotch on the eye. Visually at first I don't see any stain pickup in either of his eyes, but I will also check with one of our black lights here, ultraviolet lights here, to see if anything has picked up. This just gives me a little bit of a better look. Making sure I'm kind of looking under the eyelid so his eyes rotate so I can check all over. Eyes good. Alright, so neither of his eyes picked up any stain, which is good because that indicates that there is no abrasions to the cornea, there is no ulceration or potential scratches to the corneal surface. If there had been any stain pickup, we would have seen like a bright green, neon green splotch in that area, that damaged area, and then that would have indicated that we would have to follow up with treatments. But as there's no stain pickup, then he's good to go. So I'm going to express Maybe's anal sacs here. For this, obviously you want to have a glove. I'm going to have some cotton ready for cleaning, which on one of them, I'm just going to put some epiotic for cleaning afterwards. And we'll also have some eliminator ready to make them smell better. I will put some lube on my fingertip here to make the entry a little bit easier. So for this, I'm going to gently raise the tail, find our entry point there. I'm going to gently insert my finger. Sometimes they try to resist it, but so you just kind of keep putting gentle pressure on until you're in. So the anal sacs are kind of at the 4 and 7 o'clock range. They feel little bubbles here. I've heard it described as when you're expressing them to act like it's a roll of toothpaste and push from the bottom up. I have a cotton there so it doesn't spritz everywhere. You can see there, got some from the left one, which was pretty full but normal material and easy to express. Those are all things you want to note. So now I'm checking the right one. Same process at the 4 o'clock spot, gently pushing it up and out. Easy. Okay, bud. And gently milk it until it's completely empty. And you can see there my material. Get rid of that. Gently clean our backside, add a little eliminator, and that is how you would properly express the anal sacs. So I'm going to describe and demonstrate, walking us through the process of how we would administer an enema. Dozer here does not need one, so he's just going to sit here and be my little demonstration buddy. Things you need for the enema is obviously we're doing a water and lube based enema. We're doing it 1-to-1, so I have about half of a cup of water and I'll add lube until I reach about half a cup of lube. I have a mixer, a bowl to place it in. Then I have our red rubber catheter that I'll place on the end of the syringe, which I'll draw the mixture up in. So first off, I'll add the lube to my water here. It is important to note that for water temperature, you don't want the water temperature to be too far off your patient's temperature. That way, if you have it too cold, it could potentially cause hypothermia. If it's too cold, you could cause hyperthermia. Or if it's too warm, you could cause hyperthermia. So you want to have it as close to the patient's internal body temperature as possible to help avoid that. So I have my mixture, and I'll just mix it up. Once it's mixed, I'll just put it in my bowl here. That way I have something easy to draw my mixture up into. Just a smidge more. So ideally, you would want to use about 5 to 10 milliliters per kilogram for your patient. Dozy here, he weighs 70 pounds, so he's closer in the I looked at it and I forgot what his kilogram was. He weighed 71 pounds, which would be about 32 kilograms. But for this demonstration, I'm just going to draw up a smaller amount. So you draw up your amount desired. So for this demonstration, I'm drawing up roughly 35 milliliters of my 1-to-1 enema solution. I place the catheter onto the tip so it's ready to go. You also do want to make sure that you place lube on the tip of the catheter. That way it's a little more gentle, easier to administer it. Alright, so now I have my solution. I'll place it up here so we can kind of see Dozer here as well a little bit. So for this, oh come on my way, stand up. So for this, when I insert it, you're going to just enter it straight into the rectum. Obviously, the purpose of an enema is to get rid of any potential constipation, any blockage back in there. So you're going to insert it into the rectum as far as you can push, it in there, and then you will start to slowly administer the enema. As you do so, you want to kind of be able to hopefully work it up a little farther, so you can maybe hopefully get it past the blockage, the area of constipation, so you can break it up more easily. Once you have fully administered the enema solution, you would pull out and then get the patient situated, and hopefully they would then produce stool and be rid of the constipation. I'm going to demonstrate putting topical medication on our on Trick here. He was our dental patient today, and he's getting some Revolution applied. So we got us in position here so we can see. There we go. So when putting topical medication on, especially on cats, it is good to ensure that you put the medication up high enough on their neck. That way they do not turn around and lick it off of themselves, as cats are very, very good at turning their heads completely around when they really want to. So let me get this open. Things are really hard to get open. There we go. Alright, so for it, you want to be able to part the hair so you get direct skin contact. And for the medication here, so I'll put a drop directly on the skin. I'll also do a little drop a little bit below that, like I said, making sure I don't go too far down the neck in this cat's case here, so we don't turn around and lick it off of ourselves, because cats are good at that. And that is how you would apply topical medication. So I'm going to demonstrate how you would clean ears on a dog. Say hi. So for this, very similar to a cat, except for on dogs, a lot of times their pinners won't stay up, so you have to kind of fold them back. So for this, I'm going to take, there again, using General Epiotic, General Ear Cleanser. Squish a good amount into there. I'm going to squish a little bit around squeezing the ear canal to help loosen up any debris. Then I'm going to be taking cotton swabs. I'll go down into the canal to get our debris out. Oops. Oh, I know. It feels funny, doesn't it? So you still want to keep going until they are coming out clean. And then once so, you can take some cotton. You're gonna just put a little bit around my finger so I can get down in the canal good, and I'll do a good wipe around. This will help dry out the canal as well in preparation for any ear medications that are having to go in. And then repeat the process on the other ear. So again, fold the ear back, squish some of the ear cleanser down in there. Squish around, let it squish, that will help loosen up any debris. And they're gonna also go in with the cotton swab to get the debris out that has been loosened up from the ear cleanser. And once they're coming out clean, take some cotton there again. I'll go down in, give it a good turn. That'll also help dry the ear out there again in preparation for any ear medication. And that would be how you would clean a dog's ears. So after we clean the ears, we're going to medicate Gunner's ears here with Claro. Since it is Claro, I'm going to keep a towel ready since it can cause problems with the eyes if it gets in the eyes. So what we're going to do, we're going to lift the peanut up and sit it all the way down in to the ear canal. Gently squeeze. When we're pulling out, we're going to kind of pinch the pinna together to keep the medication in. Rub it in so that it stays in. And for shaking for this medication, we just cover their ears. That way when they shake, it does not get into any of the staff member's eyes, which he's now not shaking. So I'll stand up, and that is how you would medicate a dog's ears. So I'm going to demonstrate how you would clean ears on Jake here again. He's being a very good kitty for all of these demonstrations. So for this, we're going to use Epiotic, general ear cleanser. Oh, sorry, bud. Here we're going to gently lift up the ears. Luckily their ears stay up more. Gently kind of squish once the Epiotic is in there. You're going to use a cotton swab. Did it tickle, bud? I'm sorry. You do need to prepare for the head shaking because sometimes the tips can break off. Going to gently go down in so you can get the debris. Then also to help dry out, you can use rolled cotton or square cotton. For these smaller guys, I prefer to do this because I can wrap it around my finger. Dough it down into the ear canal. Rotate around. That will help dry out the ear. Then repeat the process on the other side, on the other ear. Use a little Epiotic in. Gently squish. Hey buddy, okay. Sometimes them shaking their heads can help loosen any of the debris that the Epiotic has loosened. Take a cotton swab. I know, buddy. Okay. Swirl around to get any debris out. There again, another 4x4 piece of cotton. Go down in the ear canal. Give it a small turn to help dry everything out. You also want to make sure that the inside of the pinna is also dry. So we're going to medicate with some Momentomax in Apollo's ears here, our lovely hairless cat. So for this, just going to gently, my helper holds the head steady, I'm going to gently raise the pinna so I can insert the tip of the Momentomax in. I'll gently squeeze, and as I pull out, I'll gently close the ear canal around it so it keeps the medication in. Then I'll repeat the process with the other ear. See. Insert in the canal, squeeze a generous amount in, gently pull it out, and kind of gently rub to help distribute the medication as well, so it stays fully in the ear. So I'm going to demonstrate giving sub-Q fluids on Gracie May here. Here we have our bag of fluids ready with a fresh needle and IV line. I'm going to put the camera here. Alright, so for this, this, a good spot to go is in between the shoulder blades, as there's plenty of pocket there for the fluids to go into. You're going to tint the skin gently, and then you'll insert the needle. You want to make sure you don't poke through the skin, because then the fluids will not go under the skin as they're supposed to. So you have to tint the skin, apply pressure until it's through. And I'll keep a hold on the line to ensure it doesn't move as we are giving the fluids. All right, now they're flowing. Can kind of watch our gauge here so you can see that the flow, it's a good flow, steady flow. As it's going in, it will make a pocket and make a bubble. She's only getting 100 milliliters of fluids, but you can kind of gently rub the area to help disperse the fluids as it goes in. Target of 100 mLs now. So after clamping off the line, I'm going to gently pinch where the needle's at. That way when I pull the needle out, like so, it can help clot the skin so the fluids do not leak back out. And that is how you would administer sub-Q fluids. So now we're going to trim Maybe's nails, our little dog here. I'm going to demonstrate on one of her back paws. Kate here is holding her in a good position. So what you're looking for is she has white nails, which make it easier. You want to trim down until you see the quick, or this little pink area here. That is where the quick is. That is what supply the blood vessels and nerves that provide the nail those supplies. So you're going to gently come in, going to gently trim down just a little bit. I can trim down a little bit more. When you're trimming down, you'll see the quick present itself as a little dot in the middle. So that is a good length for that nail. I'll move on to the next one. Girl. Black nails are a little bit harder, but you can still kind of see a little shiny to matte black on the nails. So I'll show where the quick is at. There again, also looking for that little dot. Finally, the last nail here. All right, I did not hit the quick on any of these nails, but I'll still demonstrate what you would do if you did. When you hit the quick, it will cause bleeding and pain, so you really do want to avoid it. But if I were to hit the quick, I could take this Quick Stop powder here and just gently apply it to the nail. You can kind of see a little bit, it's not sticking since there is no blood, but that would apply the Quick Stop to the nail, which would make the blood clot and stop the bleeding. So we're going to trim Jake's nails here. So on a kitty cat, luckily their nails are a little bit easier than on a dog because they're normally going to be white, so you can see and visualize the quick in there. For them, I'm just going to gently press down the paw pad to extend the nail and trim off just until right above the pink area of the quick. There again, just like on a dog, the quick supplies the blood vessels and nerves to the nail, so you do not want to quick them because that will cause pain and bleeding. So they're all 4 paws. If you were to hit their quicks, we have this powder called Quick Stop. So same process on a dog. You could gently extend the nail that's bleeding and apply the Quick Stop, and that would help clot the blood to stop the bleeding. So now on Lila here, I'm going to demonstrate an abdominal pressure bandage. This would be good for in case of emergency. If we were worried about any internal bleeding or anything or hemorrhaging, we want to apply that to apply pressure. So for this 3-layer abdominal pressure bandage, I'm going to have my cast padding. We don't have the conforming gauze or the clean gauze, so we just use our rolled gauze here for a 2nd layer, and then the vet wrap for our 3rd and final layer. So I'll put this up in here. I'm wearing gloves just to kind of simulate here. If there, we would look over the patient in an emergency situation and assess, is there any wounds that we worry about possibly contaminating? And if there wasn't any wounds, then we would worry more internally But still a good idea to go ahead and wear gloves just to prevent any potential for contamination of any potential wounds that are hiding. So for this, I'm kind of just going more abdominal. I'm going to start with the cast padding. Definitely going to need some more rolls. And for this one here, versus leg wrap, you want to make it snug on this case. Still going to have overlap about 50%. And pulling this one much more snug than you would a regular leg bandage, till you can get that even pressure. Oops, okay, well, we're just going to put that one there since I decided to rip a little bit ahead of time. So I'm going to take my next roll of cotton pad, and where my first roll ended, I'm going to begin my new cotton pad. There again, I'm going to come back a little bit further for my pressure bandage. 50% overlap. And I'll go ahead and I'll go do a second layer of the cast padding. There again, 50% overlap and pulling it snug. Now use my roll gauze here, place another layer. There again, I'll pull it snug to apply even pressure through the abdomen. 50% overlap again. And I'm making sure that the cast padding, that there's a small strip of cast padding between my more constricting layers and the skin, that is to prevent constriction from the vet wrap directly onto the skin. That way you don't cut off circulation. Now I have my second layer, and I'll place my third and primary layer. On this one, it does have a pattern there. And so since doing the pressure wrap, there again, I'm going to cinch it down tight. And so that pattern will be stretched out more than would be, say, on a leg bandage. So I can apply that pressure as well as keep the bandage in place, less likely from it slipping away. Pull that snug. So here you can see I have a little bit of the cast padding between the skin and the end of the vet wrap on all sides, all around, to apply even constrictive pressure on the abdomen for a case of an emergency that would arise. I'm going to demonstrate placing a modified Robert Jones bandage and splint. So an important thing to remember when you are placing any sort of bandage is you want to start distal and move proximal. Reason for this is you don't want to come proximal down to distal, because any fluid you could potentially trap at the bottom. After placing the stirrups. So when you're placing the stirrups, these help secure the cast padding and the layers of the bandage. That way they don't slide down the leg. Where you put them at on the leg depends on if why you are bandaging the leg. If there was a wound, I would want to place it away from the wound, so I'm not covering it. Then to help prevent the stickiness there, because everything likes to stick to where it's not supposed to stick, I can just use a tongue depressor to hold my stirrups here. There we go. There we go. All right. So now I have stirrups in place. I'll take my cast padding. You don't want to pull it so tight that you cut off circulation, but you do want it tight enough that it serves its purpose in stabilizing the leg. So when I'm moving up the leg, I gently roll, and you want to have about 50% layover between each layer. I'm pulling it tight as I'm going, but not cranking down on it. There are key areas that you want to make sure might have a little bit extra padding when you're placing the splint, such as places where there's going to be more pressure points. That's to help prevent pressure sores and causing further wounds or damage to the limb. For the splint, I'll have to go higher up the leg. This type of splint would be appropriate for a fracture of the metatarsal area. As a case where with a fracture, you want to make sure you splint the joint below and the joint above to help provide full stability. Do a little wrap up here. Up higher up the leg, I'm going to pull it a little bit tighter since it's naturally going to loosen. Pull off that first layer. Make sure there's not any cotton left and sticking out the edges that would be tempting to someone to pull out. And I'll start my second layer. The patient doesn't pull at those tufts. Now at this point in time, before I proceed further, I'm going to check my splint. I'm going to lay it up against the patient and make sure I don't need any padding elsewhere. So here, if you kind of hold it there, Jess. And demonstrate here that the cotton comes up above where the splint ends. That way it will prevent rubbing there. Another pressure point is right here around the hock. It's padded enough that it's not going to leave pressure sores. And also it is down distal enough that the splint will bear the weight versus the limb, as the purpose of the splint is to bear the weight. So now that I know that I'm set with that, I'll proceed to the next step. Like I said, I'm going to use some of our tie gauze here. And the same method, I'm going to move distal to proximal up the leg with 50% overlap. My stirrups. I always like to check the splint a couple points along the way so I don't have to backtrack. So now I'll place my stirrups. I'll twist them, lay sticky side down on both sides. Like I said, this is again, it's attached to the leg, and now it is also attached to the outer part of the bandage to help hold that bandage up and in place and prevent it from slipping down. So now I'm ready for my splint application. With the vet wrap, it is important that you don't cinch it down, as this is the constrictive part of the bandage. A good rule of thumb is any pattern on here, you don't want to stretch much past its normal design. And so, there again, I'll start the most proximal distal aspect, making sure that there is a strip of cotton between the vet wrap and the skin, as the vet wrap is constrictive. So I'll pull it out and over, and I'll lay it across the top, and on the bottom, pull, lay across the top. There we go. All right. Come on. Here on the place some elasticon, and this will help prevent traction for the pet as well as durability to the bandage, as that's where they're going to be walking on it, so you want the elasticon to help provide some more sturdiness so it doesn't get as torn as quickly. So you can see the tips of the toes there on my bandage, and so now this patient would be good to go in this splint. So now that it is placed on there, our final product, we'll demonstrate how to remove this. To remove it, first part you want to do is take off the elasticon. Pretty much going to go exactly in reverse. Oops, if I can get it off because it likes to stick. It does its job well. Some people will use a dual blade and cut down the splint, or you can just either use bandage scissors, or I even just prefer just take the vet wrap and just unravel. Sometimes, depending on the condition of the bandage, if it's been on for a few days, you know, whether if it's gotten wet or dirty or anything, or even just you have a bandage on for a few days and it's gonna have some gunk on it regardless. Remove the splint there, and I'll pull the stirrups off. Sometimes and ever so gently, worst part is removing the stirrups. Which luckily, again, fresh bandage hasn't stuck to your skin, but sometimes it will peel away the skin, and that would have to be addressed at the time. So that is how you would place and remove a modified Robert Jones bandage and splint. For pilling a dog, Lily here, she's not on any current medications that we're going to be giving right now, so we're just using a little piece of a treat. You always want to have some water. I just use a 6cc syringe with water to chase it down with. That's important, just like how humans would take a sip of water after taking a pill. Same concept with them, especially medications like doxycycline, which can cause irritation of the esophagus. Very important to chase it down with some water. So for this, I'm going to place my fingers kind of behind her canines. I'll lift her muzzle high. That helps reduce their closing power of their jaws. My other hand, I'll open the mouth, place the medication at the back of the throat, wait till they swallow, and then I'll chase it down with the water. Oop. There we go. And that would be how you would pill a dog. I'm going to demonstrate how you would pill a cat. Jake here, he's not on any medication, so we're just going to use a treat to demonstrate. So for this, here, I'm going to kind of hold behind his canines, gently lift up. I use my other finger, my other hand to pull, easy bud, pull his bottom jaw down. You okay, bud? I'll make sure that they swallow it. And I'll also take some water and flush it down. That's just to help make sure everything's slid down. I know, bud. There you go.
We got it.
And there we go. We are going to X-ray Gemma's teeth. Important thing to note is you want to have a mouth gag to keep the mouth open, as you don't want them biting down on the plate should they start to get a little bit light. So that just helps protect the very expensive plate. For this one, we'll do kind of a more bisecting angle for the upper right arcade. I'm going to place it firmly in there. You can use gauze, hey, stay on there, to kind of help support the back of the plate. There we go. Once it's firmly in place there. Our machine is a handheld unit, and it does have a scatter shield on it, but just to be extra safe, I'm wearing our radiation gloves as well as our apron, just for extra personal protection. Oops. So I'm going to make sure I have my proper settings for the teeth I am taking. That way we have the proper KBV and MAP. So for the bisecting angle, I'm going to come pretty much straight down, shooting wherever it is through the eye. I'll let it click. Now I'll come over here to view my image and make sure I got the proper image. So here, You can see the teeth, you can see, oops,
Sense already.
you can see the entire tooth as well as the root. You want to be able to see the bone line, so here you can see that there is some perhaps gingival recession here, as we noticed when we were probing. But you also want to make sure you can see the tip of each root as well. I do need to get a little further back, because I didn't quite get 110 in that shot, so I'd have to move the plate a little further back in the mouth so I can get that entire tooth in there. I'll leave it on there. Double check my settings. Sorry. There we go. There we go. Now I have that entire tooth in there. So that would be a good shot, and now I can move on to the next. Alright, so I'm also going to demonstrate some manual hand scaling. Here I do have my manual hand scaler here that I can use. And so for this one, this is good for these grooves in here with this chunk of tartar. You might not be able to get in there with the ultrasonic scaler. This one here, I'm going to apply even but firm pressure, and I can drag it towards me. You do want to be careful of the gum lines, as that would cause damage to the gums if you snag the edge. But manually here on the canine as well. There again, I'm close to the gum line, but I'm being very careful to not snag it. Do some ultrasonic scaling on Gemma here. So as I go through, I'll kind of describe the process. I'm just going to start on a couple of her back molars here. See that they are pretty gunky. So we do have water, which will help prevent the tooth from heating up, but you still want to have, where's my pedal? You still want to have 10-second contact time per tooth. That way you don't heat up the enamel or the pulp and causing damage. So I just kind of move back and forth as I reach that 10-second time, or even less for safety. I would just kind of move on to the other tooth, and I will continue moving on. It's better and easier to use the wider part of the ultrasonic scaler, as you're going to get more contact space. Your footprint will be larger, allowing you to break off those pieces and those chunks easier. I'm going to kind of move all around the tooth on all sides. And now once I'm on that tooth, I'll move back to my other tooth I was working on. There again, that 10-second contact time. That good idea is to keep the sonic scaler moving. It is also a good idea, you can kind of get under the gum line as well. This is a good future indication for, are you going to have pockets anywhere? Are you going to have those rotations? It gives you a good future view for that, as well as making sure you clean out under the gum line. There we go. So another thing to note when you're using the ultrasonic scaler is you do want to avoid any soft tissue. You don't want to get those lips in there or the tongue, because that's going to cause damage. We just chattered a little bit, so I'm going to turn this up a smidge. Another thing to note, not all ultrasonic scalers can go under the gum line like I did with this one. Ours is approved for that, so before doing it, you want to make sure that your scaler is approved for going under the gum line. So now that we have scaled Gemma's teeth, I'm going to go ahead and polish. You want to make sure you have sufficient amount of polish on your prophy cup, otherwise you're heating up the tooth for no reason, as you do want to maintain that 10-second or less contact time for the same reasons. When you are applying pressure, you want to apply enough pressure to the tooth that the edge of the cup stands out. You want to do smooth movements back and forth. No, you don't want to jerk. And you want to gently fan out so that the edge of the prophy cup does go under the gum line, as you did scale there. Some things to note. the reason why you would apply prophy paste is after you scale, you've made little microscopic crevices in the tooth that you want to smooth out. So this is like sandpapering it down, making it smooth. That would help prevent plaque and tartar buildup as quickly as it would gather otherwise, as you were taking away those little crevices that they would grab onto and hold on. Just do nice gentle movements back and forth, moving from tooth to tooth to maintain my proper amount of contact time. Go. Alright, after we've prophied, you also do want to go ahead and rinse out the mouth. There's a couple ways you can do this. You can use your air water syringe. There again, you want to, when you're doing so, you want to point the water out the mouth and not towards the back of the throat. There is that throat gag to prevent water, but just pointing the nose down will help. So this is kind of our role play assignment. I'm going to be going through the scenario that Kate's dog Dozer was in for a routine dental today. And so I'm going to discharge her, discuss options to help promote Dozer's oral health, and make sure she doesn't have any questions or concerns before she goes home with her pet. Dozer had a routine dental cleaning today. His teeth were scaled, polished, and radiographed while under general anesthesia, during which he did great. He was monitored the entire time by an assistant, so all of his vital signs stayed nice and steady during the procedure. His mouth might be a little bit sore even though there wasn't any extractions, so some things you might want to watch out for. You can just feed about half of his normal amount of food tonight, but if he's looking at it, acting like he's interested in the food, like I said, his mouth might still be sore just like ours might be after dental cleaning, so maybe just soak his food in water for about 20 minutes before feeding it to him. That will soften it without changing his diet, since I know Dozer has some food indiscrepancies. That way we don't give him a stomach upset. Talking about oral health, we do have some options that can kind of help promote his oral health. Do you brush his teeth?
I try to, but it's not consistent. So
trying is the first step. I know not every pet appreciates that, but just like us, after the dental cleaning, that's only gonna, that prophy polish paste that we put on their teeth, that's only gonna kind of keep the plaque and tartar off their teeth for about 72 hours or so. So you have a nice little happy time, but you want to afterwards promote that oral health. So if you're able to brush his teeth, that will greatly help keep the plaque and tartar off of those teeth and help the longevity of it as well. Do you have a brush at home or toothpaste?
Yeah.
Okay, good. Because you're going to make sure that you have toothpaste that is designed specifically for dogs. Human toothpaste can kind of upset their stomach, so you want to make sure it is pet-based. Mm-hmm. Any questions or anything?
Do you guys offer any other products for dental health?
We do. So there are diets and chews that can help. We have, they're called CET and enzymatic chews. They're based on weight for the patient. So we like for the smaller guys, we have smaller chews. The bigger guys, we have bigger chews. What this does is this helps reduce those enzymes that get on those teeth, which in turn reduces the plaque and tartar on it. We also have, like Hill Science Diet, they have a diet called TD that helps promote oral health as well. And there's also we have a list of products that is recommended as well. It goes over different diets and chews that we might not necessarily offer here in hospital, but other places you can get as well that will help promote oral health. And so also here are the discharge instructions, so if you do have any concerns, of course you can refer back to those as needed. He doesn't have any medication to go home today since we don't anticipate, there was no extractions, we don't anticipate him being in too much pain. It was just a mild soreness like we talked about a few minutes ago.
Okay.
Any other questions?
No, thank you.
All right, give us a call if you do have any questions, all right?
Okay, will do.
All right.